Hello, everybody around the world. My name is Keith Martin. I'm the Executive Director of the Consortium of Universities for Global Health based here in Washington, D.C., and welcome to our ongoing webinar series. Today, we are absolutely very privileged to have Maria Rosa Cutillo, who is the Chief of Partnerships for the UN Population Fund. And what we're going to do today is share the vitally important work that this UN agency does to improve the well-being of women and girls around the world, and to ensure that people's reproductive rights are protected, and that everybody, regardless of where they are, have full access to all reproductive opportunities. Around the world, it is appalling that more than 250,000 women a year die while in pregnancy, and many more suffer life-sustaining injuries. Also, hundreds of millions of women and men do not have access to all of the reproductive opportunities that they want to have to be able to improve their lives and the lives of their families. It is terrible and sad to see that in parts of the world, including here in the United States, that there has been significant underfunding and legislation passed that rather than improving the well-being of women and children and men, they're actually harming people, particularly those who are most vulnerable. And one thing that's done, is sad to say, is that there's been a removal of funding from UNFPA, which we certainly hope that the new administration rethinks to fund this organization that is helping to improve the lives of some of the most vulnerable people around the world. So with that, we're going to have a presentation by Maria Rosa. Then after that, we will have questions from you, the audience, that Maria Rosa will respond to. Before I hand over to her, I would just encourage you to take a look at CUGH's website at cugh.org and take a look at our upcoming workshop at the end of February on how you can actually maintain and strengthen your collaborations and partnerships with overseas organizations and accessing and managing US-funded projects. Also, our upcoming Global Health Conference in New York City, March 15th to the 18th. And at that time, we'll be dealing with a number of issues that Maria Rosa will be responding to today. So with that, Maria Rosa, I'm handing over the controls to you, and thank you so much today for doing this webinar. Over to you.
Thank you so much. Before I go to the slides, we wanted to thank you, CUGH. The opportunity to partner with you is very important for us. And you will see then that for us, this type of partnership actually is within a specific type of partnerships that we value very much to profile, let's say, the brand of UNFPA. So I'll just to give you a little bit of heads up on what this presentation will be about. The presentation will be about what UNFPA is, and what UNFPA does. We have a new strategic plan that will span from 2018 to 2021. We're very committed to have that strategic plan very, let's say, focused to the result we want to achieve. And you will see we'll have 3 transformational results that are a non-negotiable. I mean, we need to take action now. We cannot reach 2030 having still the situation that Keith was mentioning. So hundreds of women dying every day while giving birth, and many more not having access to proper family planning and sexual and reproductive health rights. And so many youth and adolescents already involved in what we call harmful practices, violence, and gender-based discrimination. So this first part of the presentation will tell you something about the United Nations Population Fund. And the second part is more, let's say, related to partnerships, what it means for us to partner, what are the type of partnerships we have. And I hope at the end of it, you will discover why it's so important, and we value very much the opportunity to partner with entities like CUGH. So we have been branding UNFPA as the United Nations Reproductive Health and Rights Agency. And I deliberately used the term branding This has been an exercise that has been going on for the past few years in Unfpa. Perhaps some of you know that we had an executive director, Dr. Babatunde Oshotimain, who passed away last summer, and he was the one who pushed very much for this exercise, because branding means positioning Unfpa, giving also to the most, let's say, to the common people, what is the sense, what does this organization do? You know, for example, UNICEF works for children. We work for reproductive health and rights. This is our commitment, ensuring reproductive rights for all. This means that we do that in a number of ways. This means that we have 3 transformational results. So this is somehow specified by the mission of the organization. And it's probably more understandable to say that we are supporting a world where every woman has the right to deliver in a situation where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. This last part of our mission allows us to deal with youth and adolescents, and as said before, particularly with harmful practices to youth and adolescent girls. Our strategic plan 2018-2021. So as every organization, not only UN organization, but as let's say every organization or entity, we have a strategic plan, a long vision that in our case will tell us and keep track of our path in order to reach the Sustainable Development Goals this organization is engaged with. So last year, we have been adopting our strategic plan 2018-2021. That sets this vision. And this vision is aimed at ensuring universal access to sexual and reproductive health and rights for all. Now, this is done through what we call UNFPA's 3 transformational results. The first transformational result is end unmet need for family planning. Said before, there is still a situation that, if not addressed right now, will not allow us to achieve the goal of universal access by 2030, which is one of the main priorities given by the UN. Then the second transformative result is end maternal death. Keith was mentioning before, more than 800 women dying every day while giving birth. It's just like probably 2, let's say, jumbo jets crashing every day. And so just to give you a concrete related example. And then the third transformative result is ending violence and harmful practices against women and girls. Now, this has to do, for example, with female and genital mutilation. This has to do with gender-based violence. And let's say on top of all these 3 transformational results, a particular attention is given to the humanitarian context. We lead with purpose. Now, UNFPA, of course, our headquarters is here in New York, where you have, let's say, all the transversal functions. But UNFPA has a very, I would say, particular characteristic, which is to be very much, let's say, based on the ground, based on the field. We are present in 155 countries with our programs, with the programs that we implement through our implementing partners. Being an implementing partner, for example, means being a non-governmental organization that works for us in a number of different types of programs. I probably should mention among this, for example, the programs we have with governments and with NGOs on census. We support governments on in their local, let's say, development of census practices, policies, and tools. We are a very, let's say, human rights oriented organization. Not that the others are not, but our one is very much, let's say, focused in, let's say, bringing the culture, building the culture that having access to sexual and reproductive health and rights, starting with family planning, is a human right. And that is how it has to be understood by the international community, where, as you probably know, for the United Nations, the international community is made of states, but now not only. And we will come to that when we talk about partnership. So usually the usual stakeholders for the United Nations are states. From the Millennium Development Goals and from the Sustainable Development Goals, that portfolio of supporters and, let's say, stakeholders of the UN as enlarged. To all these stakeholders, we want to show that for us, it's the world, let's say, human rights and the human right to have access to sexual and reproductive health is really the key issue. One very important element also for us, which is very, let's say, clear in our strategic plan, is the fact that we advance equality through empowering women. But empowering women doesn't mean working only with women. We feel that it is very important also to work with men. You probably heard about UN campaigns, one, for example, the He for She campaign, where UN Women, UNFPA, and other agencies are involved in having men taking the stand for women. But not only, let's say, in theory, but in practice. We have several programs on the field that, for example, are aimed at educating men on how important for all the family, not only for the women, it is to have access to family planning, or to have access to protection of maternal health. The other piece, let's say, of the conceptual framing of our strategic plan is the fact that we don't leave anybody behind. We leave no one behind. We feel very much that it's important not to see family planning or sexual and reproductive health and rights as they have been seen in the past as, let's say, in a silo. But it's important to feel that this is a way, this is one of the best ways to reach the furthest and the latest, let's say, groups of the society. And we very much implement this throughout our programs. So if you look, and we go back to what I was saying before, if you look at our partners, there's a wide portfolio, I would say. The traditional partners of the UN, and of course also of UNFPA as a UN agency, have been donors, donor governments, developing country governments, and political influencers. I would add also in this category parliamentarians. We work a lot with parliamentarians because they are the ones who help us in many countries to build a conducive environment to advance our agenda. So this is, let's say, the first group, the traditional, the government ones. Then the public, the general public, academia, though sometimes I would say it's also borderline with the institutional partners, the interested citizens and youth. Youth, we feel, are really increasingly supporting and can really make a difference in helping us profiling our organization and our mandate. And then, as you see in the third category, a full set of, a full list of private stakeholders, a full list of private partners. Now, these are partners and stakeholders that are increasingly supporting the United Nations and, in our case, UNFPA. We have the civil society, including non-governmental organizations, international non-governmental organizations, community associations, corporations and foundations. We will come to that when we reach the partnership section of this presentation, non-parliamentary influencers, communities, and media. So these three categories of partners are crucial within the achievement of the goals of the new strategic plan. Working through partnerships, through innovation, is something that is the key mode of engagement in our strategic plan. This means that our strategic plan is not only, let's say, a sort of theoretical tool, but it's a very practical one that also provides the basis for engagement with different stakeholders. And academia, of course, is crucial for us for a number of reasons. We'll see later what types of partnerships and what we want to co-create with academia and how it is really key for UNFPA. When we engage with our partners, we actually, let's say, co-create the partnership around a theme. So, for example, if you look at this slide, you will see, the mission that we described before. Also, to deliver a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. Now, this mission is achieved through 3 transformative results: and unmet need of family planning, and maternal deaths, and violence and harmful practices against women and girls. And it's important to isolate the theme that actually relates to these transformational results in order to allow us to engage the proper partner. So, for example, for ending unmet need for family planning, what we talk about is access to sexual and reproductive health and rights. When we talk about ending maternal deaths, what we engage with, and you will see that when we talk about the partnerships, is ensuring safe births in all the contexts. And this is particularly relevant when we talk about humanitarian, when we talk about fragile contexts. And when we talk about ending violence and harmful practices, we actually talk about progress for women and girls, and empowerment of women and girls. We talk about the 10-year-old girl. That's, let's say, our focus. If we empower, if governments make the right choices for the 10-year-old girl now, we will have societies that by 2030, when we have this deadline of the Sustainable Development Goals, and where we know very well we can't fail, we will have empowered women that will help transform the world. Now, it's interesting to see also on these themes what is the position of UNFPA, of the United Nations Population Fund. So we feel that, for example, in sexual and reproductive health and rights, people have the right to choose if and when to have children. This is the concept that we want to communicate. And this is why, for example, we work with communications agencies to help us transmit the right concept to the general public. When we talk about safe births, we mean that every woman has the right to safe pregnancy and childbirth, the best interest of the woman when she delivers, and also of the child. When we talk about ending violence and harmful practices, we talk about women and girls that have the right to live safe and secure in all contexts, in all environments. And the last row you see here in this matrix is what is the role of UNFPA in ensuring this. UNFPA through its programs, but I would say in general through all its actions, also through partnerships, also through communication, is aimed once to empower people to manage their sexual and reproductive health, to have the power, what we call the power to choose. About ending maternal deaths, UNFPA promotes and protects the health of women during pregnancy and childbirth. We could count several programs where our midwives are involved just in making sure that the right to a safe birth is ensured. And then for ending violence and harmful practices against women and girls, UNFPA enables women and girls to fulfill their potential by preventing and tackling abuse against them. Again, preventing and tackling abuse, let's say it's the pitch. What we want to do is really empower fully, in a holistic way, women and young girls. Again, we go back to the 10-year-old girl. So this is, let's say, the general part of the presentation on UNFPA. Again, just to summarize a little bit, the 3 transformational results and how we are engaged for them, and what is our vision now from 2018 to 2021. But of course, the long vision is for 2030. Because again, we feel that deadline this time cannot be missed. There will not be a second chance for that. So, as I said to you before, one of the main modes of engagement for UNFPA now to implement the strategic plan, both at the global, at the regional, and at the country level, is to work through strategic partnerships. So just for you to know, this strategic plan is complemented by other documents. They make it even more concrete. So we have a specific strategy on strategic partnerships that very much digs deep into how you build partnership, what are the strategic partners for us for the different transformative results. So not every partnership is good. Not every partnership is strategic. I'm sure you probably had these types of conversations also within your organization. So we first need to look at what are the general principles for strategic partnerships. The first one is, of course, the principle of relevance. A partnership has to be relevant. It has to be efficiently contributing to the achievement of the results for UNFPA, provide value, of course. It has to be also cost effective. You probably know very well that building a partnership is very, let's say, requires a huge effort, but not only. Building the partnership is just the beginning. Managing and, let's say, achieving a partnership that really has an impact for the organization requires an effort. So when we say cost effective, I mean, putting this effort has to be worthy and be properly supported by resources from the organization for the sustainability and highest quality of the partnership. I deliberately left as last what is the main, let's say, the core of relevance of a partnership for us. We build partnerships to position the brand of UNFPA as the leading agency on sexual and reproductive health and rights. So this is, let's say, the main scope of building a partnership, because we want to give voice through that partnership to all the women and to all our, let's say, beneficiaries that see our brand clearly recognized for that. There's also another set of principles which is very important, particularly when we deal with private sector. You probably know that there are issues of brand reputation. So it's very important that whatever partnership is developed with actors, with stakeholders that do not pose a harm to the reputation of UNFPA. This is why we have a set of precautionary principles, and this is why we have a very thorough, a very solid due diligence and risk mitigation process. This means that when you start discussing a partnership with a potential partner, what we do is that we look at a number of indicators and practices, and we request a feedback from that partner on indicators that protect us from any possible damage to our reputation. See, for example, a company has problems of social environmental impact of their operations. A company has been on the papers because of violation of human rights. Whatever happens, if that is one of our partners, that damage to the reputation will come also to UNFPA, and we need to prevent that. Being precautionary means that you undertake all the reasonable steps, and these reasonable steps are also validated by a feedback of a partner to make sure that the brand reputation of UNFPA is not compromised. There are actually 3 ratings that might come up and from the due diligence process. If it is a green light, we go ahead with the partnership. If it is a red line, it's a no-go. If it is a yellow line, then we start a risk mitigation framework, which means that we address all the causes, and if we are convinced, we start a partnership. If we are not, we're not going to go into the partnership. This is done both at the country, so means if in one of the 155 countries, a country representative wants to start a partnership with a local company, that will have to go through a due diligence. The same type of approach, the same type of process goes for all the countries, all the regions, and of course for the headquarters. Now, according to the strategy on partnerships, we have 4 types of partnerships: reach, resource mobilization, brain power, and alliances for a conducive environment. So in the first, let's say in the second row, you find what is the purpose of having a reach partnership. A reach partnership is, let's say, a holistic partnership that usually has several partners that give a different type of contribution according to their specific role, and that has a very strong visibility impact. Which I'll show you some examples then. Just, I mean, to give you the main objectives of these partnerships. And a reach partnership is a partnership that, as the name says, reaches a wide audience and builds a strong base of support for UNFPA. Still in the first column at the end, you see what are the, let's say, the ideal partners that we have on board for these partnerships. Usually we have corporations that have high visibility impact, academia and scientific institutions. If we partner, for example, with CUGH, we're sure that the partnership is not just, let's say, with one entity, but it has a wide span of reach. So it has a wide impact for us in communicating our mandate, in communicating our programs, in communicating our 3 transformational results. Then the second type of partnerships you have is the resource mobilization, which means attracting resources for UNFPA's programs and initiatives from what we call the non-traditional donors. So usually the traditional donors are the governments. These partnerships look at non-traditional donors. And usually the resource mobilization, the type of resources you can have is in cash, services, in-kind services, and in-kind products. And at the end of this column, you see the ideal partners for these types of partnerships are corporations and foundations, high net worth individuals and their foundations, individuals in general, so the general public, the usual, let's say, fundraising from general public, which we are rolling out this year, and the civil society. For high net worth individuals, there's a whole discussion about due diligence, which is very interesting, and on which we're working also with other UN agencies to have a sort of common approach. Then the brain power partnerships. The brain power partnerships actually are aimed at partnering on innovative solutions. But innovative, it's not only a theoretical exercise. We are an organization. We are not a spin-off where only ideas just come up. We need to find ideas and innovative ideas that actually allow us to address our technical bottlenecks. For example, we have a very wide supply chain on delivering commodities, and usually we have severe bottlenecks in reaching the last mile. So what happens is that, for example, we are partnering with corporations that can help us with their logistics system to develop a more effective way to deliver these commodities. So in fact, you see here in the last part of the column, we have corporations for innovative solutions, scientific institutions and leaders, and multi-stakeholder initiatives. And then the last but not least type of strategic partnerships we have is alliances for a conducive environment. This means, let's say, building that consensus for UNFPA with parliamentarians, with civil society, and now increasingly governments, for example, are launching multi-stakeholder initiatives where they have private sector, academia, parliamentarians, civil society all together to support UN agency. And so this becomes very important, particularly in non-conducive environments where our mandate is more difficult to profile. And then I think I still have 10 minutes, but wanted to share with you some examples. An example of REACH partnership, the Safe Birth Even Year campaign. Safe Birth Even Year actually looks at delivering, protecting the rights to deliver in a safe environment in humanitarian fragile contexts. What you find here is one piece of the partnership. It has many partners. We'll see them later. I'll show you the slide. But for example, in this case, the creativity for the partnership was provided by Benetton. So Benetton has a creative and social, let's say, track record of talking about social issues and communicate them all over the world through the public. So their part of the partnership was providing this creativity. Here you see a cake with a candle, because this campaign was launched last year. And so the first creativity was a woman delivering. Now, since UNFPA has granted through its programs the right to this woman to deliver in a safe environment, now this child is 1 year old. Here you see the different partners to this campaign. They have consolidated themselves around a pledge. And here you see the logos of the main partners. All of them give a different type of input to the partnership. Johnson & Johnson, for example, actually provides resources, money to the partnership. Baby Box provides baby boxes in kind, with several examples. One of them is Haiti. Benetton Creativity. Parsons School of Design here in New York has designed a new garment for women in humanitarian contexts that will be implemented by Hella Clothing. That is a, that you see on the far left, second row, that is a garments company. This is still within the Safe Birth Event year. You see the baby box and the delivery of the baby boxes in Haiti. An example of resource mobilization partnership. Two partnerships with Zonta. Zonta is an international, an association of, an international association of women. It has chapters all over the world. So every year Zonta chooses some causes and programs to support. They're very much, of course, into women's rights and sexual and reproductive rights. And so they are deciding to support UNFPA. And this means that this is supported all over the world, not only from the headquarters of Zonta, but from all its chapters. I have still 4 minutes and I'll go very quick. This is another very interesting partnership with Merck for Mothers UN Foundation. This goes into the operations of corporations where UNFPA can provide sexual and reproductive trainings on sexual and reproductive health and rights to women who work in supply chains of companies all over the world. This allows us not only to have resources, but also to really create an impact in the sustainability strategy and tools of the companies that decide to come on board. Unfpa Partnership, Bill and Melinda Gates Foundation for UNFPA supplies. And particularly, this is a program of family planning, and which helps UNFPA and UNFPA supplies, the program I told you before, to that delivers commodities. This program, particularly supported by the Bill and Melinda Gates Foundation, is active in 46 countries. And of course, we wanted to bring the example of CUGH and UNFPA. The Memorandum of Understanding has been recently signed, but we really see it as an opportunity in the areas of cooperations that we have designed together, and particularly education, training, and research opportunities. Your support in our REACH activity and possibly the development of flagship programs that help us to advance our mandate. And this is some examples of alliances for a conducive environment with associations of parliamentarians. Here you see the logos of 4 of them. And this is our website. You're very welcome to visit it. And if you have further questions, I'm happy to leave also my email address after the question time we'll have later. Thank you. And I think I've been in the time, which is unusual for an Italian, but I think I can make it.
Maria Rosa, mille grazie. Thank you very much. That was a spectacular presentation of the work that UNFPA is doing. And what we'll do is go to some questions. But I just want to take license from CUGH here. Number one, thank you for outlining all of the partnerships that UNFPA is having. I think it was important to showcase that these are with governments. This is with the private sector, like Merck. This is a big international NGOs like the Bill and Melinda Gates Foundation, and how you work cooperatively for them to be able to improve the health and well-being of women, girls, and men around the world, particularly the most vulnerable. And CUGH is very proud for the collaboration that we started last year, and we would like to make sure it continues. We will obviously look forward to working together with you and your team at Unfpa. So before we get to the questions, I would encourage everybody online right now to please submit your questions for Maria Rosa. But Maria Rosa, I'd like to ask you a question, and it's important, it goes into the value, because a few countries have actually decided to withdraw funding for Unfpa and largely for reproductive health options. Perhaps you could just share the value, the important social, economic, and health value that providing access to reproductive health options is, and also that improving maternal health really means you have to strengthen the surgical ecosystem, which is vitally important to reducing maternal deaths and disability.
Yeah, I mean, on this, I would definitely just go back to the initial, let's say, remarks on the 3 transformational results, no? So we feel that, but it's not only Unfpa, it's of course a shared perspective from all the UN agencies, from all the UN, that the framework provided by SDGs is quite an important, ambitious one. At the same time, we cannot fail on that framework. So the 2030 deadline is not a deadline where we will say, okay, we have achieved something, we'll do better in another 20 years. So this is why this transformative agenda on guaranteeing women's rights and guaranteeing sexual and reproductive health and rights is a key in that overall framework. It's the basis in that overall framework. And for us, it means, so if you ask me the value, the real value that we every day work to communicate in all our different, let's say, areas of work, for me and for my team with partnerships, are of course communications and resource mobilization from donor countries. This is the key value that we have to communicate. That's the starting point. Guaranteeing, let's say, those rights is a prerequisite for many other rights. So that is, and I have to say that this is, let's say, progressively being recognized more. Of course, sometimes it's not easy, particularly with some stakeholders, but that is actually, if you ask me the value, that I would say is the basic value.
Great. Thank you very much, Maria Rosa. It's important. Hundreds of millions of people around the world don't have access to basic reproductive health options, and this is life-saving for them. So the first question comes from Felix, and he wants to know, how do you handle the tension between investing in reproductive health and fragile health systems? How do you deal with the tension and convince governments and partners to invest in reproductive health when there are many needs within health systems?
Okay, so of course, I mean, when you negotiate, let's say, an investment with a government, I understand that this question is about investments, let's say, from traditional partners, no, funding from traditional partners. Partners, also traditional partners, have different, let's say, priorities that they have. But one thing I would say is that humanitarian is kind of transversal, is felt, of course, as a priority for most of the governments. And it is a priority also for Unfpa, because, as I said at the beginning, the 3 transformational results, when I said on top of this, there's the humanitarian perspective. So one more, let's say, field, one more transversal field to the 3 ones, no? So safe births, access to sexual reproductive health and rights and family planning, youth and adolescents. Humanitarian for us covers all of them. And we have in our programs, sometimes we end up having our humanitarian, let's say, team covering at the same time all of them. So it's quite a priority for us, and it's felt as priority also for many governments. So it's not a matter of, let's say, preferring to guarantee in the world safe births in general. Sometimes we really ourselves need to make that first. So, and this is part of the negotiation with governments.
Thank you very much, Maria-Rosa. The next question deals with dealing with corrupt governments, and we know that the 1.5 to $3 trillion is lost every year to corruption worldwide, compared to official development assistance, which is around 142 billion. So the questioner wants to know how UNFPA deals with the difficult challenge of governments that may be quite corrupt.
Well, of course, it's a no-go as long as well the corruption is proved. Of course, for us it's a no-go. You see, it's the same thing. I mean, the criteria that we use for due diligence in partnering with someone, and I would say to non-traditional, cannot be different. It's not that we say, okay, we're not partnering with a corporation that has a track record of corruption, but we could do that with a government. It's not the case. I mean, the same type of integrity, it's a matter of integrity, we need to ensure at all levels. It's a no-go. So there are some key basics that ensure the integrity of the organization, but I would say not only for UNFPA, I would say for the UN in general, that are simply a no-go.
Great, thank you very much, and it is an important issue and a difficult challenge, to be sure. We have a number of questions that have come forth, Maria-Rosa, about, and it's quite exciting. People from around the world are actually emailing in saying, how can we as universities engage with UNFPA? Before I ask you to answer that, I just wanted, for those of you who are online right now, please check out CUGH's website, cugh.org, at the Consortium of Universities for Global. We would, if your institution is not a member of us, we would love if you were able to join. We have declining costs depending on whether you're a high, middle, or low income country. So please consider that and look at the information that we have on our website to engage with us. But dealing directly with UNFPA, Maria-Rosa, what can you say to the number of people who are emailing us and saying, how can we engage and support the work that you're doing?
Well, we can, well, I mean, taking into consideration what Keith is saying, no, because correct me if I'm mistaken, Keith, so many of the colleagues we have on the line are connected or are part of the CUGH network.
Yes, and around the world, it's an open access, so we have hundreds of people around the world who are listening to us right now.
Okay, so I confirm what Keith was saying, and if you want additionally to partner with UNFPA, you can simply reach out to us. I'm going to give you an address. I'm going to share with you an address, and we can start discussing, and we can co-create. So the way we develop a partnership, which is also what we have done with Keith and with CUGH, is that we see where our intersection can be, and from there we co-design a list of activities on which we want to work together. I came from the private sector, so I like to have a very, let's say, pragmatic way. So we have a memorandum of understanding, but we want to have some meaningful, even small, but to start meaningful and strategic activities that we want to work together. So if you are interested in our mandate, please bear in mind that for us, cooperation with academia is really key. You have seen the different types of partnerships. There are several ways we can engage with. You can replicate our message. You can train your students. We can support you. There are ways we can also work together in involving individuals. So there are different types according to your specific organization and according to what we see could be the pitch. So you can write, you can write to me, and I'm happy to forward this to my team and discuss with you the best possibilities of cooperation. So my address is Cutillo, CUTILLO @unfpa.org.
Thank you very much, Maria Rosa. I think you're going to get a number of people who are really looking forward to engaging with UNFPA. A question from Lillian, and she wants to know, is there a map showcasing where UNFPA works of the 150 plus countries? Is there such a map that people can look at?
Listen, there is a map that I can probably share with you. I don't know how you can then share the document with everybody, but I'm happy to share it with you. And then we'll soon have most probably also a new website, interactive, with an interactive map with programs, partnerships in that area, presence of different governments. So again, I can retrieve this updated map from my colleagues of the Media and Communications branch, and I can share it with you, Keith, and I don't know if your team somehow can share it with the colleagues online.
Yeah. So what we'll do, Maria Rosa, is after this, and it really leads to a question that Sarah has posed, whether or not this webinar will be with PowerPoint, your PowerPoint slides will be shared widely. We can discuss that if they're acceptable. Then what we do, Sarah, is we share all of the PowerPoint presentations to the degree that the presenter allows, and it'll be online on our website at cugh.org, and that'll be up within a week. And then we'll also add Maria Rosa's map, as she just mentioned, to that, so everybody can have that. A question that Hartley has is about students and how they can become involved and active in the work that UNFPA is doing. Can you share anything that's applicable and specific to students?
I can share one example, one discussion that, for example, we're having with some academia institution. I'm not disclosing the name just because we're still in the discussion. So, but it's an ongoing discussion with an academia stakeholder that is not exactly in the field of health, but is in the field of fashion. And what they're doing is that they want to have some programs that put together the fashion designing with women's rights, and particularly with, let's say, the section of women's rights that is addressed by UNFPA and the 3 Transformational Results. This means that we're co-designing a course where we will be involved and where we will, let's say, transmit this type of competency, and after that we will co-design together, let's say, a sort of curriculum. What is the win-win here? The win on our side is that we are able to reach out to a wide audience. We can have events together. We can have also like different and creative events. They were thinking about dedicating a fashion show, for example, and their win is that they support our mandate for sure. So they are very much human rights oriented, but they're also able to provide a different type of curriculum, which is not only technically, of course, it's 95% technically, or let's say 90% technically focused on fashion designing, but it also has a big part of social impact component. Why is it important? Not only because you build the awareness of new generations, but also because if these guys then want to go to work in companies that deal with garment production, now these companies have increasingly developed sustainability and corporate responsibility strategies and tools. So these young people will be ready to have also that type of knowledge and will have a competitive advantage which is more, let's say, which is more consistent, no? So they will have more chances to be employed. So our win is that we will have a partner that will help us and help us also creatively to, let's say, communicate our 3 transformational results. Their win is that they will have a different, innovative, and impactful curriculum for their students.
Maria Rosa, that was fantastic. And before I just close up, I just want to, on behalf of all of us at CUGH, I just want to thank you very, very much for doing this. Thank you for all the work that the team at UNFPA does to really improve the lives of some of the most vulnerable people around the world. It is not the story that some people know about. It is a story that everybody should know about because it is really providing care to the most vulnerable, protecting the most vulnerable, and improving the lives of those who sometimes fall through the cracks of life or are voiceless. So thank you for giving voice to them.
Thank you. It's been a pleasure.
And what we'll do, thank you, Maria Rosa, and what we will do for everybody online, we'll have the PowerPoint as much as we can. Maria Rosa's up in a week. And I encourage all of you to please come to our conference in New York City, March 15th to 18th, where you'll see the Executive Director, Dr. Canham from UNFPA, who will be speaking. We will have events specifically for students on the 15th. We will have events on the 15th specifically with our partners in Africa, the African Forum for Research and Education and Health, a whole half day on nursing. So there are a lot of issues on the 15th on our satellite day. Almost all of them are free to attend. It's in New York City, but please register at cugh2018.org and register for the conference, which happens from the 16th to the 18th. So thank you very much for our attendees around the world for listening to us. I'd like to thank Karen Lamb here in the office and also Dalal Najjar and Arisa Koyama. They actually make everything happen. And to you, those of you signed in, please share Maria Rosa's PowerPoint presentation widely, and that way we can educate many people about what they're doing. So thank you very much, everybody. Thanks again, Maria Rosa. Mille grazie, and ciao, and we look forward to seeing everybody again for one of CUGH's webinar series. Have a wonderful day, everybody.
Bye. Thank you.
Ciao.
Ciao.